daily usage of contraceptive pills and would like to try something more long-lasting as a contraceptive method, this video fits for you. IUD stands for intrauterine device, and intrauterine devices are placed inside the uterus through the vagina and cervix by your healthcare provider. They are made mostly from plastic and contains a string that comes out through the cervix inside the vagina, but it should not come out from your body. As you can see through the picture, the doctor examines you with a speculum, and then she grasps the anterior lip of the cervix with a tenaculum and measures the depth of uterus gently. After finding the depth of uterus that usually normally is between 6 to 8 centimeter, she will adjust the length of the IUD with this measurement and gently passes the IUD through the cervix and then release the IUD inside the cavity. After that, she will extract the external layer of the IUD, that's a plastic pipe, and then cuts the strings that coming out through the cervix. The length of the string inside the vagina, the final length would be 2 to 3 centimeter, but if you feel it during sex, it can be shorter in next follow-up. A few minutes procedure in office and painless in expert hands. There are two most common types of the IUD. First is copper containing IUDs and the second one is hormonal containing IUD. The first one, that it is copper containing IUD, contains the amount of IUD in the stand of the device, that it is in T shape, and it prevents sperm to reaching the fallopian tube, and through this mechanism can prevent the pregnancy. Usually the effect of this IUD can last between 7 to 10 years, depends on the amount of the copper that is used in the making it, and you can remove it at any moment that you want to get pregnant or switch to other methods of the contraception as we discussed earlier. With progestin or with hormones are preventing pregnancy through the thickening of the mucosa of the cervix or thinning the lining of the endometrium inside the uterus. The effect of this type of IUDs can last between 3 to 6 years, and you can remove them as by your doctor or gynecologist as soon as you want to get pregnant or you want to switch to other methods of the contraception. It is an ideal method for people who don't want to get pregnant and they don't want to check to use a daily method or something that needs weekly attention. And they would like to have a contraception that be highly effective in prevention of pregnancy. Usually IUD has no effect in your fertility, and after removing it you can recover to normal fertility immediately after removing the device. That is a simple procedure usually doing in the gynae office, and your gynecologist remove it very quickly. A very small risk that IUD comes out during the heavy menstrual periods. So it's important to follow instructions of your doctor after insertion of the IUD and go for a checkup for first month after the insertion of IUD to check the place of IUD, that is it in good place inside the uterus and it's not moved. Whenever you feel that maybe it's moved, you feel something inside the vagina, then you should have a backup method like condom and take an appointment with your doctor to check the place of IUD. But it's very uncommon to have such a complication after IUD insertion. History of recent pelvic infection like gonorrhea or chlamydial infection are not a good candidate for IUD insertion at the current moment if you have a recent pelvic infection. Also, the people who have congenital anomaly of the uterus with abnormal shape of uterus are not a good candidate for IUD insertion. So always you should consult with your doctor before IUD insertion, and they will check you, examine you, and being sure that everything is normal. And then you can try to insert the IUD as a contraceptive method. Usually your doctor visits you 1 month after the first visit that she inserted IUD inside the uterus to check the place of IUD and if you have any concerns about the new method that you are using as a contraceptive method. You can do a swimming 3 days after IUD insertion. And for gym, you can go back to your gym activities immediately after IUD insertion. There is no contraindications that you cannot do your activities that you did previously. Just for vibrating plates that maybe you using during gym activities, you should avoid it till next visit that your doctor checks the IUD place and she assures you that the IUD place is in the good position and you can go and use normal ordinary devices that you used before the IUD insertion. Do not use tampons 4 weeks after IUD insertion, and after that whenever you are using tampons during menstrual period, you should be aware that it's possible that strings of IUD sticks to the tampon, and whenever you are going to remove your tampon or change it, then you pull the IUD out or maybe displace the IUD. So you should take care about this also. The other point for the tampon that you should not use tampons more than 4 or 6 hours and when you have IUD, because it increases the risk of pelvic infection. We are using IUDs as an emergency contraceptive method. In this way, we are using IUD in first 72 hours to 5 days after unprotected sex, and by insertion of IUD, we are preventing reaching sperm to the fallopian tube and preventing pregnancy. You should consider that 3 to 4 weeks after using IUD as a contraceptive method, emergency contraceptive method, you should do a blood test for pregnancy and make sure that you are not pregnant. The most important points that usually people don't know when they're using copper IUDs is that the mechanism of this IUD, as we discussed earlier, is making a slight inflammation inside the uterus so that it prevents sperm to reach the fallopian tube. By using anti-inflammatory medications during the month, you are going to decrease effect of the IUD. So whenever you are going to use some medication, talk to your doctor and ask her or him that is it fit with your IUD or no. And if it's going to decrease the effect of IUD in that month, you can use other methods of the contraceptions like condom as a backup.